I am David Jones. I'm a physician. I have an active practice in Ashland, Oregon, and I also am very active in the field of functional medicine with the Institute of Functional Medicine. I've had the pleasure here at Sonovive, which is an internationally famous center of healing in Rosarito Beach, Mexico, of having a sports injury treated by John Thorpe. The injury was a fairly serious injury. At the time, I thought I had fractured my hip, but what I had done had aggressively extended it, playing tennis, going back for an overhead. And in injuries of this sort in the past that I've been dysfunctional for 6 to 8 months in the healing process. On this particular occasion, I was treated within the first 3 weeks and only lost a week after that of playing active tennis.
We're all looking for the machine like the metal detector. You can walk through it and get totally treated, you know, like Star Wars. But it's more hands-on.
Hi, I'm Dr. Steve Sinatra, and my story goes back to this machine. Actually, about 5-6 years ago, I was fighting off a hip replacement. I saw John Thorpe in Southern California. When he worked on me, I had some improvement in my hip, where my hip joint actually felt better. Since I had so much improvement, when my son became ill with a multisystemic disease relating from mercury and fungus and mold and electropollution from EMF, his weakness and his immune system dysfunction and really responded to this as well. In fact, my son credits earthing, in addition to the Equiscope here, as really getting him back to a situation where his health was much more optimized.
My name is Dr. Richard Delany. I'm a clinical cardiologist and internist in private practice in Boston, Massachusetts. I'm board certified in internal medicine, cardiology, critical care, and geriatrics, and certified in functional medicine. I've had this opportunity over this past year to use this remarkable equipment firsthand on my patients. I'm able to do a history and a physical examination and determine where in the body there is pain and think about the mechanism of how it got there and how I can prevent it. And then I use a non-invasive microvoltage technology that reduces pain, improves function, and is lasting for the patient. It's simply remarkable. I've treated patients from knees to backs to shoulders to wrists and systemic fatigue. And the protocols developed by John Thorpe and Dr. Ferrier, when implemented by a physician who's trained simply in this technique, is outstanding.